My experience using the AvaGen test has been nothing but positive. Initially, I was a little bit concerned about asking patients to pay out of pocket for another test, another device in the office. Um, my preconceptions were completely wrong. Most of the parents, most of the patients are very receptive to doing genetic testing. In fact, many of them reach for it and get excited. And I've even had patients, I offered genetic testing to one of their children. They said, "Oh no, we're going to bring all the children in," and we end up doing testing on 3 or 4 kids at once. So it's really been a very positive feel. I think that patients like the idea of learning more about their genetic risk. Parents like learning more about the genetic risk for their kids. I like learning more about the genetic risk because it helps me treat those patients properly and catch patients early. There can be a little bit of fear when you say we're going to do a genetic test, because right away people go to, "Oh, I have to get a blood test or go to a lab." And I say, "No, we'll do the test right here. My technician will come in. It's just a cheek swab. We're just going to take some cells off the inside of the cheek with a Q-tip." And right away you can kind of see it. "Oh, this is not going to be a negative experience. I don't mind a cheek swab. It's just going to take a couple of seconds." And we can even do this test on very young kids. There's really no pain or fear involved. Whenever you're doing genetic testing, though, I think it's important to be responsible, and you want to have resources available to those patients. And myself, I don't know much about genetic counseling. Luckily, AvaGen does provide genetic counseling to any patient who wants it or requests it after they get their test done. So if a patient wants to learn more about what this genetic test means, or what the results mean beyond what I can tell them, we can go ahead and set them up with a genetic counselor, and that's included in the test. And so there's no additional fee for that patient. So I think my biggest mistake in implementing the genetic testing was really my own fear that patients wouldn't want me to talk about it with them or ask them for it. And it's just been the exact opposite, where patients really appreciate the fact that we are going the next step and trying to look a little deeper into keratoconus, trying to make earlier diagnoses and treat them and their entire family properly.